Good evening. Greetings from Boston. I'm Dr. Pratibha Shah. I'm representing the Global Council for Ayurveda Research today in hosting this month's Journal Club meeting. I'm the founder president of this organization. So I'll take a couple minutes to just introduce the organization, and then we will pass on the platform to our presenter for today, Mr. Chad Friel. So Global Council for Ayurveda Research is a 501(c)(3) nonprofit. It's an international nonprofit at present. We started as a national nonprofit, but we are now global. We are tax exempt. Our mission and vision, I will just share briefly our mission and vision and our website URL. So here you can see that our mission is to encourage, educate, and facilitate basic, clinical, and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. And we have been doing that within the constraints and limitations of operating in a country like United States, where Ayurveda is still not licensed. So some of our projects or initiatives are the Journal Club meetings, which we are hosting today. We have one Journal Club meeting every month. We also have a global webinar monthly series where we showcase a subject matter expert with some relationship to research in some way. So that is another monthly offering. Both are free. Our website URL is www.ayurvedaresearchusa.org. It's very easy to remember, ayurvedaresearchusa.org. If you can go on the website and check out the different resources and some of our past conferences, projects, symposiums, etc., you can see our work there. I would like to just call out for everybody who's listening in later on to consider donating to our platform, because like any other nonprofit, we survive, we operate based on donations and only, nothing else. So if you can donate, if you can click on joining as a volunteer. We always need volunteers. Every nonprofit is always in need of volunteers. I'm also a volunteer at Global Council for Ayurveda Research. So please consider donating, if not in kind, in cash, but in kind, by donating your time. It would really be appreciated. Please check out our social media pages by the same name, Global Council for Ayurveda Research. We are on Facebook, we are on Instagram, and we also have a decent presence on YouTube right now with 1,000+ subscribers. So please check out. And if you can become a member at a very, very nominal fee of $25 for the whole year, you can access all the resources, some of which are open to public access free, but some of them are under membership. And you can access everything once you become a member at a very, very nominal fee of $25 for the whole year. And if you're a student, it's only $50. So please check out our website. And with that, I would like to welcome our speaker for today, Mr. Chad Friel. Chad, are you there? Okay, good. I didn't see you in the video. So I'll just read out a few lines about Chad. His bio is up on our various platforms, social media, etc. You can read in more detail over there. But Chad Friel grew up in Regina, Saskatchewan, where he completed his education in remedial massage therapy at the Western College of Massage Therapy, with over 15 years of experience as a registered massage therapist. Chad's career has focused on orthopedic assessment, musculoskeletal injury, shoulder rehabilitation, therapeutic exercise, and stress management. So, welcome, Chad. Thank you for taking out time to contribute to this practice that we have tried to offer on a regular basis, where anybody, whether you're a student or a practitioner or a clinician or a teacher, academician, you can hone your critical eye. And science and research is all about critical eye. So let's see how we can critically review a published study. Over to you, Chad.
Thank you very much. And thank you everyone for joining. Thank you for having me. I'm just going to share my screen here and make sure it's the right one. And I'm going to put it in slideshow. Just make sure you can see. It should say effects of Nasya therapy for cervical spondylosis. All right, perfect. We'll get started. So I picked this journal article for a couple of reasons. This is actually my first time doing this. I have obviously read journal articles in the past, but I haven't specifically critiqued something like this. And I'm grateful to be here, especially as a student of Ayurveda. I'm about a third of the way through my studies. So this has been a great learning experience for me as well to do this. So I picked this because I am familiar with cervical spondylosis, and I've started to develop an interest in Nasya therapies as well. Let's get into it. So the study summary, I just need to create some space. There we go. You can still see it, right? Hopefully. I think we're good. All right, the study summary. It is a study designed to assess the efficacy of Nasya therapy to reduce symptoms of cervical spondylosis, so neck pain essentially. It is a short study relatively. It's 21 days long. And the Nasya therapy itself was administered for 7 days, specifically with Danwantaram talam, so it's a herbal oil. Other key herbs used in this treatment, and my apologies if I do not pronounce it right, the Gandhar Vahastadi and Gugulu Tiktaka. There were 36 patients, along with a 1-month follow-up. So a small study, and I'll just go over the authors a little bit more in detail on the next slide. The title of the study is a randomized controlled clinical trial to assess the efficacy of Nasya in reducing the signs and symptoms of cervical spondylosis. The study was published in 2012 in the IU Journal. The main author is Dr. Radhika, and the study was done in Kerala, India. Just a little bit about the authors. So the main author is a lecturer and also works in the Department of Dravagunya Vijnan at the Government Ayurveda College in Kerala, India. And then another author, Dr. G. Vinod Kumar, professor and head in the Department of Panchakarma at the Najali Ayurveda College also in India. I'm not sure how to say that one. I'll skip that one. And then Dr. K. Mihirajan, associate professor, Department of Kaya Chikitsa, also at the Government Ayurveda College in Kerala, India. I will go over a background first. So we'll discuss cervical spondylosis, the Ayurvedic Samprapti, and then Nasya therapy, and then we'll get into the study in more detail. So what is cervical spondylosis? Some of you may have heard of this. Some of you may have heard of arthritis of the spine, and that's mainly what it is. It's a specific term referring to arthritic changes here in the cervical spine. Arthritis can occur in any joint in the body, but here we're looking at mainly in the neck. It is a degenerative condition affecting the structures of the cervical spine. And I've got a little picture I will go over in a minute. We look at the vertebral segments, which are all these little bones here. There are 7 in the cervical spine. And where arthritis or spondylosis often shows up is typically around the vertebral segments of C3, C4, C5. And that is due to the apex of the neck. That is where the lordotic curve is most prominent. So we tend to lean forward and then extend our neck, and then we cause damage to those joint surfaces. So it affects the facet joints, where the vertebral segments sit on top of each other. It'll affect the capsule as well, which is the type of connective tissue that wraps around the facet joints. And then it also affects the ligaments a little bit, stretching some of them, but also causing them to lay down more tissue, and then they end up hardening a little bit as well. And then it can affect the vertebral discs, which could lead to possible disc herniations or slight bulging of discs. And then, of course, we get bone spurs as well, which essentially is a form of arthritis too. I'll talk about those again in a second. The Ayurvedic Samprapti, so this is another way of looking at the degenerative changes in the neck from more of an Ayurvedic perspective. So it is correlated with Vata Vyadi, which is a degeneration where Vata aggravated conditions occur. And it is associated with the depletion of nourishing tissues. So we're losing that lubrication in the synovial joints. We're losing that blood flow to the area, which is called Dhatu Kashaya, is the nourishing. And then we have imbalance of Vata dosha in the neck region, and the neck region is also called the Griva region. The Ayurvedic goals in this study is Brimhana, which is to nourish the tissues, and then also lightening therapies or Laghana therapies. And this is mentioned in the paper as well. The causes, basically it is undernourishment or wasting away, which is apatara panajanya, another long word to say. Therefore, Brahmana therapies make the most sense for degeneration of the spine because they are nourishing types of therapies. Coming back to the actual neck, so the cervical spondylosis, as I mentioned, it is wear and tear of the cartilage, eventually affecting the bones. We have osteophyte or bone spur formation that occurs, and that's typically where the pain is coming from. People are having bones rubbing together, and that doesn't feel very nice. It often will lead to narrowing of the neural foramen, where the root of the nerve from the spinal cord exits the vertebral foramen, and that causes compression, also known as cervical radiculopathy, or spinal cord compression if it's more severe inside of the spinal cord. And then during these bony changes in the spinal canal, they'll compress on the nerves, and then they'll elicit symptoms down into the brachial plexus, which go into the arms as well. So some patients will report numbness or tingling going down into the arms. So the main symptoms of cervical spondylosis: neck pain, general stiffness, sometimes headaches will occur, typically in the occipital region, so at the back of the head. And then you can get that radiating pain down the shoulders or to the upper back, along with numbness, tingling, and even weakness in the arms and hands. And that's more of the severe cases. Typically, they will have limited neck range of motion, which makes sense because they've got bone-on-bone growth and they're unable to move the neck in rotation, extension, flexion. We'll get into the ranges of motion later. But they have limited range in all motions of the neck. And then in severe cases, they may have vertigo or balancing issues, coordination problems. I don't think any of the patients in this study had bladder or bowel dysfunction, but if the spinal cord itself is involved, it could affect that. Typically, that happens more in the lumbar region, though. Some of the risk factors of cervical spondylosis are the aging. So it's most common after age 40 to 50. However, in society these days, it is starting to show up to people in their 30s and even late 20s. What causes it, or likely to cause it, is the occupational strain. So prolonged neck postures, sitting, texting, scrolling, leaning forward, it puts more stress on the head and the neck. And as I mentioned this, I'm sure some of you guys are starting to sit up straighter to protect your neck. Other factors are previous neck injuries, sedentary lifestyle, and then there may be a genetic predisposition as well. Moving on to Nasya therapy. So what is Nasya therapy? It is an Ayurvedic therapy of introducing herbal medicines into the nose, into the nasal passageway. There are many reasons to put oil into the nose, not just oil, but herbs as well, medicines essentially, to purify, nourish, and strengthen the head region to any related symptoms or for general health as well. It balances all doshas, especially vata and kapha, and then it promotes clarity, immunity, and vitality. The nose is the doorway to the head, it is said. The nose is considered the gateway to the head, shiras, by administering medicated oils or powders or juices or even fumes like smoke. You can influence not only the nasal area, but also the brain, the sense organs, the nervous system, and then even the emotional mind. So the main purpose in Ayurveda with Nasya therapy is to cleanse the excess doshas, especially kapha from the head and sinuses, to strengthen sensory and motor functions, improve memory, voice, vision, mental clarity, manage headaches, help with sinusitis, other neurological disorders, and stress-related diseases. Here is a picture of someone administering or about to administer Nasya therapy, so pouring oil, medicated oil into the nostrils. So the main mechanism of action is the oil and herbs move into the head space essentially. This is the Shringataka, which is a horn-like meeting point. That is I believe that should be the Sanskrit translation. So it is the meeting point of the 5 sense organs in the head. This may be related to the limbic system. It most likely is. However, it's hard to relate Ayurvedic directly to Western medicine. But the limbic system is composed of the hypothalamus, the thalamus, the hippocampus, and the amygdala, which are all important for emotional regulation. It's the point where our hormones kind of meet our nervous system. So the oil also will travel down into the neck, and there are neuropeptides in the oils that are said to have an effect on the neurons in the brain and to help decrease pain. So this slide just shows a couple of things. The limbic system itself on the left. So we have the hypothalamus, we have the thalamus and the amygdala and the hippocampus. And you can see here, it helps to regulate things like emotions, memories, the autonomic nervous system. And then on the right here, I have a graphic of the nasal cavity with the olfactory apparatus or the olfactory nerve. So as you can see here, we've got a little flower. So if someone was to smell an aroma, those odor molecules travel into the nasal passageway and they go directly to the nerves of the first cranial nerve, the olfactory nerve, which is going straight through the skull, as we can see, and directly to the brain. I mentioned the first cranial nerve, one of the shortest cranial nerves. So it's pretty amazing that Ayurveda realized that we can directly influence the brain by putting things inside of our nose. So the herbs can be quite powerful by putting them into the nose. And then I added this little information about the nasal passageway. It's obviously our natural breathing organ. It filters, it humidifies the air. It warms the air a lot too. It slows breathing, produces nitric oxide, and then of course supports oxygen delivery, stabilizes the respiratory system, and it is very essential for optimal physical and emotional health. There are a lot of new breathing methods and breathing techniques that are becoming popular these days. I've read a couple books on that. So we've learned that the nasal passageway, along with the epithelial tissue and the olfactory nerve, are really quite powerful. So during Nasya application, the head is meant to be lower than the legs. Typically, we're lying in a supine position, patient is on their back. And then in this study, 4 milliliters of medicated oil are dropped into the nose. The patient waits a few minutes and breathes in through the nose to allow the oil to move towards those olfactory nerves and the epithelial tissue. Moving on to the study and the treatment. So the Ayurvedic strategy was done similarly to previous, I'm assuming as previous problems with cervical pain, but we obviously added the Nasya therapy. So I found this interesting about the study. There was a lot of lead up to the actual study. There was some similarities for the first little bit. So all patients received the dry fomentation for 7 days, designed to prepare the body to induce sweating. And then they also had a leaf fomentation done for another 7 days, along with Gandharvahastitadi Kashaya, which is a herbal decoction, and that was administered 2 times a day, along with Gugulu Tiktaka, which 90 milliliters was given 1 time per day. And then we split the groups into 2. We had the control group and then the Nasya group, and the Nasya group took the Nasya oil for 7 days. There was also a Nasya preparation, which include abhyanga, so massage to the neck, as well as steam, ushma sveda. It didn't say exactly where on the neck. I'm assuming the posterior area. And the oil that was used for the abhyanga or for the massage was the same oil used for the Nasya therapy. Patients were examined thoroughly. I'll talk about what they did to test the patients too in a little bit, but we looked at patients' blood and urine, for example, and then we used assessments of pain, tenderness, radiating pain, numbness. We looked at range of motion, or they looked at range of motion, I should say, and hand grip strength. So the pain scale that was used was the visual analog scale, the VAS, and that is a scale that looks just like this. And the people would rate their pain either from 0, no pain, or to mild or moderate. Severe pain would be between 8 and 10. It's unlikely that anyone would pick 10. That would be unbearable pain. There was also tenderness grading. So the patients were given a grading scale. A grade of 0 would mean no tenderness. Grade 1, there was some joint tenderness. Grade 2, there was wincing with pain. So there was palpation involved and the patient would wince. Grade 3, winces and withdrawals or pulls away. And then we have grade 4, which in which the patient does not allow for palpation of the joint at all. So that would be quite a lot of pain. And then the results were measured the same way with the pain, tenderness, radiating pain, numbness, range of motion assessments, and hand grip strength. So as a student myself, I should mention I am not fully equipped to understand all the readings of studies. So the numbers here, I don't recall exactly how they translate. Some of you guys might know, but I will look at these p-values a little bit, and then we'll explain how things changed. So with pain, there was a p-value of greater than 0.001 here. It was 3.5 change for the Nasya group, so significantly better. Tenderness was also significantly better. With the vertigo, there was no change, which probably means that the vertigo wasn't directly related to the neck pain. Radiation pain changed as well. No significant change with the control group. And then with the Nasya group, significantly better. Numbness, about 40% change with the Nasya group. And then I'll go through the ranges of motion here. So some of you may know these. Just in case you don't, I'll do them on camera too. So during cervical extension, so neck extension, looking up, lifting the head, Nasya group significantly better. Bringing the head down in forward flexion, also significant. Right lateral flexion, bringing the ear to the right, significantly different. Left, the opposite side, also significantly different. During rotation, there was a significance as well. Nasya also better, so rotating to the left and then to the right. And then the grip strength, sorry, the right hand grip strength changed, but the left hand grip strength not as much. I can kind of speculate, maybe most people were right-handed, so the changes in the right side of their neck really helped with their right hand. I'll go through the herbs and ingredients as well as their effects. So as I said before, both groups received the same preparation protocol, the Ruksha Sveda for 7 days, followed by Patra Patalis for 7 days. So during the first 14 days, they received the same thing. And then the test group received the Nasya therapy of Dhanavantaram Talam. And that, as I researched it, I found out it's typically the same, but sometimes there might be some variations of ingredients. It is a medicated Ayurvedic oil that has quite a lot of herbs. It is named after Dhanvantari, the divine physician of Ayurveda. And it is a very powerful rasayana or rejuvenation therapy that targets vata disorders and strengthens the nervous system. The base oil is typically sesame oil. And it also includes dashmula, bala, ashwagandha, shatavari, gaduki. As I said, there may be slight variations, and this next slide has a list of the ingredients, specifically of this one that I found on the, I got the reference at the bottom of the page of the slide presentation. I can't remember which website. So you can see here quite a lot of herbs. I did put in the 10 roots of dashamula as well. I don't think I need to explain all those. Most of you probably know them better than I do. So moving on to the interpretation of the study. So I'll go through a couple of different points. The pain relief mechanism. So how does it work? So Nasya provided significant pain reduction compared to the control group, as we saw in the results. The Brahmana Nasya is Vatahara. It pacifies Vata, which essentially calms the nervous system and then reduces pain. It stimulates the brain via the olfactory pathway, which I mentioned earlier on, through the nasal passageway. And then it leads to that neuropeptide production, which are natural pain relievers. The role of the Mridipaka and Arvatana. So this is gentle cooking, so it's not like boiling the herbs. It's just slowly heating them up so that the herbs mix together, ensuring that they work at their best effect. And then it was repeated a couple of times too. I can't remember if it was somewhere between 3 or maybe even 21 times.
21.
But
21.
yeah, 21 times. This dual solubility facilitates better absorption through the olfactory mucosa and interaction with the neural receptors. The olfactory pathway and brain activation. So Nasya stimulates the olfactory epithelium, impacting areas that I mentioned in the limbic system, the amygdala, hippocampus, thalamus, and hypothalamus. And these are also concentration points for those neuropeptides. There was relief of neck stiffness. So there was the nourishment to the tissues, counteracting dehydration of the intervertebral discs. And this likely helped reduce degeneration and relieve some of the stiffness, essentially trying to bring oil back into the body. There was also a reduction in tenderness. So the Dhanvantaram contains the dashmula and other Vatahara anti-inflammatory herbs, and these reduce swelling as well as pain and improve on that tenderness of the body. The impact on the radiculopathy. Though Nasya can't reverse those osteophytes or those structural degenerative changes, it can improve circulation and reduce nerve root irritation. And I'll talk a little bit more about the Abhyanga and the massage but the treatments and the techniques used can also help to change the position of the head and the neck, which can help to relieve that radiculopathy and realign the spine as well. Which brings us to the improvement in range of motion. So it alleviates the aggravated vata, reduces stiffness, and then improves that neck mobility too. Looks like we've got a few more people coming in. No major change in vertigo relief, although it's very statistically minor. Some patients subjectively felt some relief from vertigo. Vertigo is caused by vitiated vata pitta interacting with rajas, and this Brahmana Nasya therapy helps to pacify vata and pitta, and then it could help to nourish and stabilize the nervous system, therefore reducing vertigo. And there was that improvement in the hand strength, mainly on the right side as opposed to the left. So strengthening was observed in the patients, and they indicated that neuromuscular rejuvenation based on the grip strength. The nourishing abilities of Nasya, the unctus oils essentially replenish the tissues that affect that natural wear and tear, or sometimes we call it aging. Personally, I don't like to use the word aging mixed with wear and tear because I think it has more to do with proper care of the body. And moving to number 10 here, explanation of cervical degeneration. So the cervical spine is vulnerable due to loss of snignabhavas, the moisture, the stability, the synovial fluid. There's disc dehydration and bone degeneration, which represents exhaustion of kapha and rise of vata. And then, of course, the Nasya therapies, being oily and medicated, helps to reintroduce those qualities. And therefore slowing the degeneration. Other principles supporting the action: the nostrils are the gateway to treat the diseases above the neck. According to Samanya Siddhanta, introducing substances with certain qualities strengthen those qualities in the body. We increase some oil, and then we get more tissue stability. And then these medicines will also assist in the body's natural ability to heal. And then the last little bit of interpretation here. So the therapeutic goal was essentially rejuvenating Brahmana Nasya with those oils. It stimulates that kapha restoration, promoting the repair against that further degeneration of the cervical spine. The classical Ayurvedic explanation of Nasya pathway, I mentioned it earlier, but it's the medicine is traveling through the channels into that point inside of the head. It spreads to the ears, the nose, the throat, the eyes, essentially cleansing and clearing doshas and relieving upper body disorders. I wasn't planning to mention too much of this, but you can get pretty detailed when we talk about this Cushing reaction. So this last little point, so when the patient lies down, there's a change in pressure of the cerebral spinal fluid. And then when they come back up, it essentially kind of pulls the oil back in due to a change in arterial pressure, similar to the feeling we get if we lay down for a while and we feel kind of lightheaded. The actual Cushing's reaction can be much more extreme, but the idea is that Nasya works in a similar way. So conclusions. Nasya therapy combined with conservative Ayurvedic management was significantly more effective in reducing pain and tenderness, as well as numbness, and improving the spinal movements of the neck than conservative therapies. It also showed a capacity to slow the degeneration. This is, of course, is theoretical. The study didn't look at the patients right after, at least it didn't explain that they looked at them through radiographic imaging or MRIs. But the idea is that it is nourishing those depleted tissues. And the good news is there's no adverse effects reported. So some of the considerations and limitations: it was obviously a very small sample size, so there was only 36. There was no placebo group. I didn't mention earlier, but one dropped out of the control group, and then two out of the Nasya group, but they were pretty even in the end still. The preparation, so the dry fomentation, may have also had an effect, and it's unknown which herbs actually had the best effects, right? There was about 21 different herbs used, so we can't really pinpoint which herbs are the better ones to use. It was likely a combination of quite a few of them, but we don't quite know which ones based on the study. There are subjective outcomes. Pain is obviously subjective, so there might be some bias. The mechanism of action is still hypothesized based on the Ayurvedic principles. So it lacks that modern biochemical verification. And the study is about 13 years old, so it is relatively old. And then some other considerations. The study used a complete Ayurvedic treatment for both groups, not just the Nasya therapy. So, for example, I'd wonder if just providing Nasya therapy alone to, for example, some of my massage patients, maybe would they expect positive results too, like without massage. But I feel like the massage also had an effect. So it's difficult to tell which exact protocols were in fact most effective. For example, the massage, the fomentation, the Nasya. And then I think it did mention there was some range of motion exercises involved. And then the steam essentially was done to the neck area, which also adds heat and moisture, which can improve range of motion as well. Overall, the clinical takeaway, so for practitioners of integrative and Ayurvedic medicine, adding these Brahmana Nasya therapies with Dhanwantaram Talam may provide a safe, effective adjunct therapy for patients with cervical spondylosis, particularly for pain, stiffness, and then, of course, improving that neck mobility. And then here I have the references and links here. There's a link to the actual study. Thank you, everyone. I will stop the screen share and see if there are questions or comments.
Any questions or comments? Interesting paper. Yes, Kriti.
I didn't have a question. I just turned on the camera.
Oh, yeah, feel free to ask questions or comment.
Maybe I'll go first. Maybe others might take a cue from that. So, in the interest of, so I'm going to comment on two things. Thank you. Thank you, Dr. Shiva. So, I'm going to comment on two things. One, because this is a platform for learning. So, I'll just comment a little bit on the format of Journal Club. And then I will share some comments on my quick read of the study just before we started the session. So, for Journal Club, I think just to be precise to the format, I think it's great to, yeah, great presentation, I must say. Very good presentation, very clear and well prepared. So for Journal Club format, it's really important to focus on the paper itself. What have they published? Because I think if all the explanations that you shared were things they should have included, because they have not shared the details of the formulations. What are the ingredients? What are some of the differences in different formulations, depending on which text you're picking up? Those details are not there. And references are missing for some of their modern biochemical hypotheses theoretization of what could be happening in Nasya. There are no references in that entire section. Just for future journal club presentation should ideally focus what's missing in what was the paper about, what are the strengths, what are the limitations. That way we can go deeper into what the authors have missed out. Your explanations were a great filling in for some of the gaps actually that the paper has. So how many of you read the paper? Did you have a chance to skim through the paper? Probably not. Okay. So we try to encourage that so that way journal club participation is even more enriching. So if you look at the paper, it's a little casually written. It's a little casually written in terms of you also see kind of even in the reference section, some beginnings are capitalized, some are not. Overall, you see a little bit of a casual approach. The conclusion section ends abruptly with no proper um, uh, closing statement of this is an encouraging finding, but more studies are needed or more clinical trials are needed. It does not end like that. It ends very abruptly. They have not given the details of formulations. That's one thing. And they have not clearly mentioned the after was immediately after the treatment or at the end of 1 month. That is not specified anywhere. That's a big miss, right? Now, to also talk about the p-value, I just wanted to say this: the bigger numbers are the scores. So they had higher scores, and in the Nasya group, and p-value of less than 0.05, not greater than, less than 0.05 is always statistically significant. So if it is higher than 0.05, it is statistically insignificant. So we can say, okay, the patients here felt better pain-wise. But what was the exact score and what is the p-value from it? It has to be less than 0.05. Only then it is statistically significant. So very interesting paper. And it does give some pointers to Nasya therapy as being maybe a strong inclusion as an adjunct therapy. But you're absolutely right that we cannot really say whether the preparation itself was alleviating some of the symptoms and improving the scores of pain and movement and stiffness, etc. Loved the presentation, Chad. This was very well prepared, very well prepared. Thank you.
Thank you.
I'm sure people who listen in later and watch in later will be intrigued enough to pick up the study and go through it. I'll just share it just in case, just one thing that I have mentioned that at the end they have not taken enough care to. I'll just show you the reference section so that you can see. So if you see just here, it's a small thing, but it shows lack of attention to detail. You see how it's starting with either, uppercase or lowercase. It's a small thing again, but it matters, And then see how the conclusion ends with just 3 bullet points with no statement for future, right? And then this whole section, they're assuming certain things, but they're giving absolutely zero reference here. The whole part, your Cushing's effect and all that, no reference for that. This whole section has no references at all. So these are some of the weaknesses. I know from personal experience when I was doing my master's in public health, when I had done a white paper on type 2 diabetes, a lot of publications from India have been rejected because they don't measure up because of one reason or the other. What you're seeing here, that's enough basis to reject this as a scientific paper. So that's very unfortunate because they made an effort, but they forgot to tell the afterwards, immediately after the 21-day treatment or whatever, 7-day treatment, or was it at the end of 1 month? That's such an important information is missing in the published paper. So we don't know what is the duration, after follow-up, whether it was at the end of 1 month or just the 7 days treatment. So those are the drawbacks. So in conclusion, not all published papers are to be taken on face value. They should be critically read, critically analyzed, critically assimilated, and only then you can quote certain papers as robust scientific papers. So thank you, Chad, for taking us through this journey of looking at a published paper with the critical eyes and seeing what could have been done better so that the findings could have been accepted in a better way.
Well, thank you.
Thank you. Thank you so much. Thank you. And thank you to everyone for joining at an odd time, at least in the East Coast. It's pretty late. It's 10:30 now, almost 10:15. So thank you for joining, and thank you to everyone who's going to watch it later on our YouTube channel. Okay.
Thank you, everyone.
Thank you. Thank you.
Thank you.
Have a great night. Thank
Good
you,
night.
Chad. Once
Thank
again.
you. Take care.
Take care. Bye-bye.